Hi, good day. Today I'm going to talk about ABC model. ABC model can be done in REBT therapy and also CBT therapy. So ABC model in REBT therapy focus more on disputing the irrational belief, while in the CBT it focus on disputing on the cognitive distortions. So first I'm going to show you ABC model for REBT. So first, as you can see, that is activating event. Activating event is when you go through a situation. For example, last week I have this presentation. So during the presentation, I need to present my work for this coursework. So that is my activating event. That is a presentation for a coursework. So before we go to the belief system, first we go to consequences of the event. So the consequences of the event is, I think I did bad for the presentation. So that is my example. A, activating event is presentation. C, consequences of the event, I think I did pretty bad for the presentation. So from this event and consequences, we look to the belief system. So the belief system, first, the belief system. So my belief system during the presentation is, I think my presentation is not good enough. I think I should do better for my contents. I think I should have practiced more with my presentation. That is my belief system. So as you can see, from the activating event, that is the presentation for the coursework, I immediately believe that my work is not good enough. I should have done better. I should have more practice with my presentation. And see, consequences is, I think I did pretty bad. So to prevent this from happening again, for example, we have a lot of presentation this semester. So to prevent my next mistake or my next irrational belief, as you can see, I irrationally thought that I did pretty bad. So to dispute this, we look at the disputing the belief system. So we need to provide evidence for disputing the belief system. So my evidence is, I have done plenty of presentations before. I have done good presentation. I also have a few experience of bad presentations. So obviously, which one should I choose in order to dispute this belief? So by comparing my good presentation to my bad presentation, if I would say I have 70% more of good presentation than 30% of bad presentation. This is an evidence. It shows that 70% of time I spent on my presentation, I did better, while 30% is pretty bad. Probably I just stuttered for a bit. So 70 and 30, obviously 70 is better. So this is my evidence. Another evidence is, when I talk to my colleague, when I talk to my classmate, they told me that my presentation is not as bad. My presentation is actually pretty clear. It's not, the stuttering did not interrupt my flow of content at all. So that is another evidence for my presentation. So this evidence can be used to dispute my belief system, which is, I think I should have done better. I think I should prepare more, I think I should prepare better content. So that is the irrational thoughts. So rather than comparing my belief system, rather than comparing my work to another person's work, I should focus more on disputing my own belief system. So the shoot, the mask, the odds, these three are mostly referred as irrational beliefs. So to change from irrational belief to rational belief, I will use this evidence continuously in order to create new feeling. So with new feeling, I can gain more confidence. I can do better for the next time. I also will feel less nervous for my next presentation. So as you can see, from A, B, C, D, F, D, E, F. From A to F, we can create completely new feeling. But of course, this does not work in instant. This need practice, and practice. Okay. Next, for the CBT example, which concern more about cognitive distortion.